Good afternoon. Sorry to keep you. Good afternoon, Rhode Island, and thank you for tuning in. Next week, we'll be back with our usual Wednesday 1 p.m. time slot, and I want to thank you for tuning in today on a Thursday. But next week, we'll be back at 1 o'clock on Wednesday. As always, if you haven't yet, please sign up for the daily newsletter at governor.ri.gov. And if you haven't yet downloaded the Crush COVID app, about 100,000 Rhode Islanders have. If you haven't, now's the time to do it. And I appreciate that. So today, before I go into the data, which we will do in just a second, I want to introduce the folks that I have up here with me on the stage, some new faces with me this afternoon. I'm sure you've seen in the news over the past few days about what's happening in our hospitals. And the truth of it is our hospitals are overwhelmed. The staff in the hospitals are exhausted. Emergency rooms are overflowing, and staff shortages are becoming a real issue. And I've been up here week after week after week, imploring you, asking the good people of Rhode Island to stay at home and change your behaviors, our behaviors, so that the folks in the hospitals who are on the front line don't get too overwhelmed. But I thought that instead of just hearing from me, we would have an opportunity for you to hear directly from some of the folks on the front lines. And so permit me to introduce to you who I have with me today. On my very far left is Dr. Sooner. Dr. Sooner works at the emergency room at Rhode Island Hospital, where he serves as the Director of Disaster Medicine and Emergency Preparedness. Thank you for being here. Next to him is Dr. Otis Warren, an emergency physician at the Miriam Hospital, who also serves as the president of the Rhode Island chapter of the American College of Emergency Physicians. And to my right is Dr. Laura Foreman, the chief of emergency medicine at Kent Hospital in Warwick. And Dr. Foreman will also be serving as the medical director of the Cranston Field Hospital when we open the Cranston Field Hospital site. And in a few minutes, when I'm done with my announcements, I am going to invite Dr. Foreman to speak about the reality facing her and her colleagues in emergency rooms and in hospitals today. I felt that it was important to do this because this is very real. We are in a terrible spot. And for those folks out there who think it's okay to not follow the rules, who thought it was okay to have Halloween parties, you need to know that that's costing lives. And I was chatting with these physicians earlier, and they were just saying folks are tired. They, their moms and dads as well, they have been working without a day off for 8 months, and they and their teams are tired, overwhelmed, exhausted, and it's on the rest of us to do the right thing so that our hospital systems don't get too overwhelmed. So in a few minutes, I will introduce Dr. Foreman to share her human experience of what it's like right now inside a Rhode Island hospital and emergency room. But before we do that, we'll do what we always do. We'll begin with the data, and I ask you to please put it up on the screen. If you take a look at the dashboard, you should look at that dashboard and you should be alarmed. So I'm going to pause for a second and ask everybody to just pause and look at the numbers. Yesterday, we had 936 new cases out of about 20,000 tests for percent positive of 4.7%. A few weeks ago, I was up here, we were under 2%. It shows you how quickly our fate can change. This is our second consecutive day with over 900 cases, so we've set a new record for Rhode Island. We also saw, very sadly, 7 new deaths. You'll also see the weekly trend data on your screen, and that is the alarming part of the data, the trend, week over week. You'll see all three arrows are pointing up and a percent positive of 3.9%. New hospitalizations at 228 and new cases at 362 per 100,000. We've passed our thresholds for hospitalization and cases, which is why those two arrows are in red. And we continue to set new daily case records. Our hospitalizations are at their highest they've been since May, and they've doubled just over the past couple of weeks. So at this rate, we will need the Cranston Field Hospital in a couple of weeks. I will point out this is not unique to Rhode Island. America, and indeed the world, is facing the same reality, which is the second, or in some places third, wave of the virus. Yesterday, the United States set single-day records for new cases at 140,000, and also a new record for daily hospitalizations at 65,000. Nationally, we added 1 million new cases in just the first 10 days of the month, which is the fastest we've ever had. Massachusetts announced 2 days ago they're building new field hospitals. New York followed our lead and yesterday announced they'll be lowering the gathering limit to 10, which we did a couple of weeks ago, and closing businesses at 10. In Texas, they're bringing in mobile morgues. In North Dakota, their hospitals are at full capacity. Germany, the United Kingdom, and parts of Italy are on total lockdown. That's where we're headed, folks. Total lockdown if we don't start to get more serious and follow the rules. I'm often asked, what about schools? I would like to point out that places are seeing a second wave or a third wave, regardless of whether the kids are in school or not. Cases are rising at the same rates everywhere, whether schools opened 6 weeks ago, 6 months ago, or haven't opened at all. And in Europe, they're generally keeping schools open even during the lockdowns, because we all now know that schools are not major spreaders, and also children suffer mightily and in the long run if we close our schools. So if it's not schools, and if we're doing a lot of testing, what is it? What is it, you're asking? It's what we've been talking about for weeks. Small gatherings with friends and family, people you know, people you like, people you let your guard down with, people who feel safe, that occur primarily indoors with masks off. It's that simple. Earlier, I was chatting with the physicians. Part of the reason they're crushed now is because people insisted on having Halloween parties a couple of weeks ago. And now you see it in the cases, clear as day. You continue to see it. People willfully disregarding what we're asking, which is to shut down these informal social gatherings indoors without masks. The hardest thing about managing this crisis is that if everybody just stopped it, if everybody committed themselves to not having these social gatherings, to wearing masks, to limiting your social contact to a very few number of people, we would have the control to put a lid on this virus. But it doesn't seem to be working that way, and I fear that we are moving towards another lockdown. Over the last few weeks, I've put in place a number of new interventions. We've been taking action week after week. A month ago, I closed break rooms and told businesses to go back to remote work. That has happened. 2 weeks ago, I lowered the social gathering limit to 10. Last week, I took more aggressive steps with early business closures, a nighttime stay-at-home advisory, a stop on business travel, lower capacity limits for houses of worship and venues of assembly, lower limits for catered events, lower limits for big box stores. And we're closely monitoring this to see if that's enough. It is still my hope that that will be enough. But I'm not optimistic based on what we're seeing in the data. So I'm here, I guess, one last time, pleading with the people of Rhode Island to make changes in your life, to wear your mask always, to stop having social gatherings of any kind, period, and to really rein it in. That choice is yours. As I said, all over America, all over the world, we're back to lockdowns. I have avoided it as long as possible. I don't want to go there. I've taken a half a dozen incremental steps over the past month to apparently not much effect. I'm frequently asked, Governor, will we go back to phase 2? I don't think phase 2 would help. It's not enough. Phase 2 was smaller limits at restaurants, lower limits at retail. That's not where our problem is. Our problem is informal gatherings. 6 or 7 people coming over watching football, just all of us just not taking it seriously enough, hugging people. It's with people we know, violating our quarantine, sneaking out of isolation before we're supposed to. I wish the consequences weren't so dire, but the fact of it is they are. And so I worry that we're getting close to some pretty extreme measures. As for hospital capacity, Dr. Foreman's, as I said, going to speak in a few minutes about the situation on the ground in our hospitals, but I'd like to take a second to give you the big picture of where we are, where we've been, where we are, and where we're going. We currently have 84% of our existing COVID capacity beds filled, so 16% of our COVID beds are available. At the rate we're currently seeing cases increase, those beds will all be filled in about a week. Beyond that, each hospital has a plan to turn on their surge capacity so they can flex at the hospital. That would increase the number of beds available for COVID patients to about 600. That puts an enormous strain on our hospitals and on our staff. It also is it's a risk for the people of Rhode Island. Don't be surprised if you go to the emergency room and you're diverted to another emergency room or you're made to wait. Providence hospitals are doing this. Longer waits in the ER, longer waits to be admitted, ambulances, as I said, being diverted to another hospital in another part of the state. Even with the hospital surge and the extra, up to the 600 beds, we believe our hospitals will be completely filled within about 3 weeks, at which point we would flip over to start using the Cranston Field Hospital. I've instructed the Department of Health to begin running the drills at the Cranston Field Hospital to get ready so that we are ready to roll when we need to turn it on. The field hospital is not a full service hospital. It was built specifically for COVID patients. In the Cranston Field Hospital, there's oxygen connected to every bed, but it is not a full hospital. In the coming days, the Department of Health are going to be working with our hospitals and nursing homes to stand up a healthcare coordination center, which will help transfer COVID patients between hospitals where there are open beds and transfer COVID patients to designated skilled nursing facilities and nursing homes. So we need to keep the patient flow moving. We're at a point now where we need every available bed. So if there's somebody in a hospital and is able to be discharged to skilled nursing facility, we need the skilled nursing facilities to go ahead and accept those patients. I know you're nervous to do it. It's different now than it was in the spring. We have special facilities that have COVID patients, and before we release somebody to you, they will be tested at least twice to be negative before you receive them. We need you to go ahead and accept these patients so we can make space in the hospitals. So that's a particular ask that I have for nursing homes and skilled nursing facilities. The Healthcare Coordination Center is going to function like an emergency operations center for hospitals, tracking data in real time and taking a unified approach to patients statewide. We're a small enough state. We want to operate as a holistic system. By the way, I want to thank the leaders at Lifespan and Care New England working seamlessly together. You see that demonstrated on this stage. This is a whole of Rhode Island response. So I'm calling on all healthcare providers to work together, and those in the community, if you're asked to take these patients, please help us because we need to make way in the hospitals. Sometimes I wonder, I hear from people who say they're just not going to follow the rules. It doesn't really matter anyway. And it's hard for me to understand that because it does matter, because people are dying every day. And I think if we all spent a day in the shoes of one of these patients in a hospital or a family member who's trying to get their child into an emergency room and is made to wait, I think we'd all get a little more serious about following the rules. The surge is coming at a rough time. I was just chatting with the physicians earlier. Not only are staffs tired because they've been working for months, but the hospitals are filled with patients for non-COVID issues. Back in April, hospitals were empty because folks weren't showing up with other issues. And of course, that was not there's now a pent-up demand for people who'd stayed out of the hospital. So now it's actually quite a bit worse than it was in April and in May, because you have full capacity for non-COVID healthcare issues, and also a surge in COVID, and also we have exhaustion among the teams in the hospitals, a strain on staffing levels, and it's going to get harder and harder. And when we open the field hospital, that's another massive strain. So as I had to do in the spring, I am again calling on all healthcare professionals in the state of Rhode Island to please give us a hand. We will soon be needing you in the existing hospitals or in our field hospital. You can go to skillsforri.com and sign up. And those of you who received a temporary transfer license earlier in the state's response, we're going to be extending those licenses for another 6 months. So if you are a retired doctor or nurse, if you are a doctor or nurse or a CNA or a healthcare professional who has some time, who maybe you're not fully retired, partially retired, part-time employed, we need you now. We need you now. We need to staff up, and we need help. So skillsforri.com, please go ahead and sign up. Okay, a little bit of good news in the state's response. We are constantly trying to improve our systems, and I know we do need to do better, and we are getting better every day with testing and contact tracing. The volumes are pretty intense. But one area where we've made substantial progress is making it easier for people to access their test results. That's really key. If you get tested, and particularly if you're positive, we want you to know as quickly as possible, and then we need you to go ahead and isolate. And that's why we are continuing to make testing more accessible, testing in local health clinics, testing right into the community, testing in public buildings, testing in doctor's offices. The thing that we've lacked until now is there's not really been a clear process and a one-stop shop for people to receive the results of their test. And I know that's an issue. I know that's an issue. You go someplace, and there's different ways to get tests. You could do the K-12 portal, you could go to your physician, you could go to a pharmacy, and there hasn't been like a simple way for everybody to quickly receive their result. So today I'm announcing that as of today, that's changing. And regardless of how you've scheduled your test, everybody can access their test result by going to portal.ri.gov/results. Portal.ri.gov is what we've been using, /results. So again, it doesn't matter how you schedule a test. It doesn't matter. If you get yourself a test, you don't wait for someone to call you. Don't worry. You can go yourself to portal.ri.gov/results. You can log in. There's a security process to authenticate that you are who you say you are, and you'll be able to access your result. This is really important. It's vital that when you go get your test, you give them a phone number or an email, because it's that phone number or email that we will use to authenticate that you are who you say you are when you try to log in. If it doesn't work, and I'm sure there'll be glitches, and I'm sorry, and we'll work to fix them, or if you don't get your result after a few days, there could be any number of reasons, so then you should call the same way, 222-8022, and get your result. As soon as you see that you're positive, you need to isolate yourself. Don't wait to be told that by the Department of Health. The minute you know you have a positive test result, go home, stay home, isolate yourself. If you don't have a secure home, if you have a big household and it's impossible, then let us know. You can call 211. That's the easiest place. And we'll figure out a way to get you the food delivery you need, get you a safe place to isolate, a hotel room if you need it. But the important thing is that you get isolated as fast as possible. So this is a big deal. I want to say thank you to my team. They've worked really hard on this, the tech team. The one-stop shop for results is going to help us a lot. Some other good news. We have had great success with the Take It Outside campaign. As hard as the health crisis is, the economic crisis is just as bad, and particularly hard hit have been our restaurants. We've provided 111 grants, and the results have been amazing, actually, providing money to help businesses take their business outdoors. We want you to keep staying outdoors as long as possible. It is so much safer outside and in places with a lot of airflow with the windows open. So continue to keep your business outdoors. We still have the Take It Outside program. The other good news is we've been in touch with cities and towns. Many of them had relaxed their zoning requirements to allow for outdoor dining, outdoor vending, outdoor sales. They've all agreed to maintain those relaxed zoning and permitting regulations through the end of the year. And it is my hope that the cities and towns will do that into next year. And it's my hope that next year, next summer, you can do even more business than you did last summer to try to make up for some of how hard this year has been. So some good news, and thank you to the cities and towns. The good news is, thankfully, we have unseasonably warm weather. I hope that lasts. If it doesn't, we're going to grab our coats and hats and blankets and stay outside. But cities and towns are allowing the zoning restrictions to be relaxed through the end of the year. And I hope they're all going to continue to do it into next year. More good news, the vaccine. You know, this is a terrible situation and our lives have been upended, but it's not forever. You know, I've been saying that a vaccine will come and hope is around the corner. And this week we had a huge boost with the news of Pfizer's vaccine. The Pfizer vaccine trial showed 90% effectiveness in their trials of that vaccine. And that rate of effectiveness is much higher than anybody expected. A lot of experts would have been thrilled with 60 or 70%. Over 90% is extraordinary. And by the way, as compared to the flu vaccine, which I got yesterday and I hope everyone gets, it's much more effective. Pfizer and another company called Moderna, which has taken a similar approach to their vaccine, are going to submit the data this month to the FDA. Based on that timeline, and assuming things go well, we could have a vaccine in Rhode Island for a limited group of high-risk people before the end of the year, with a vaccine becoming widely available in the beginning of 2021. That's such welcome news. I hope you all breathe a sigh of relief. Hope is on the way. We want this to happen quickly, but we also want it to happen safely. I'm frequently asked these days, hey, Gov, would you get the vaccine? Would you have your family get the vaccine? And the answer is yes, once it goes through all of the proper channels, approved by the FDA, data validated by the scientists. So I want to remind you that a few weeks ago, I announced the formation of Rhode Island's very own COVID-19 vaccine subcommittee. It's a group of experts charged with conducting an independent review of the scientific data related to the COVID-19 vaccine. All the data is public. That's really important. Really important. All the data on the vaccines is public. So it's free to anyone to analyze. Most of us aren't experts to analyze it, which is why I put together a Rhode Island-based group of scientists who will go through all the data and give us their opinion. Our local group is a layer on top of all of the safety reviews that are going to be done at the national level. So when people ask me if I would get the vaccine and I say yes, it's because I have confidence in the transparency of the process, in the process of the experts. And I like it that we have our own team of Rhode Islanders, Rhode Island experts, our friends, family, and neighbors looking out for us who are looking at the data. I've also charged the vaccine subcommittee to advise me on how to distribute the vaccine. This is going to be hard. If we thought distributing N95s was hard, this is much, much harder. So I want you to know we're not sitting around waiting for the vaccine. Right now, today, I have meetings, we meet every day, we are planning for the vaccine distribution so that we're ready to hit the ground running the second we receive these vaccines. Our initial plan is already publicly available at the Department of Health's website. It calls for rolling out the vaccine to priority populations in phases based on people's level of risk. Phase 1 is likely to include groups that are high risk, healthcare workers, people with 2 or more underlying health conditions, people in nursing homes, people who are very severely compromised immune systems. Phase 2 is likely to include teachers and school staff, childcare providers, and workers in other high-risk settings. All older adults and others. So we want to be a limited supply initially, be coming to us in waves. So it's really important that we have priority, and we're going to be prioritizing based upon risk. So, you know, if you're a young or young-ish healthy person, it's going to be a while before you get a vaccine. Phase 3, and you'd be phase 3, young adults, children, remaining lower risk individuals. and we'll be fully transparent later. I'll have a whole presentation on how we're distributing the vaccine, but I think it's important for you to know we are making a plan now. Each vaccine has its own requirements. Some have to be stored in particular very cold freezer or refrigeration. Others spoil very quickly. Some are 1 dose, some are 2 dose. There's a number of manufacturers. So we are creating a plan, and I have complete confidence that when the vaccines are ready, Rhode Island will be ahead of the game. That's the good news. That's the light at the end of the tunnel. These next few months are going to be the toughest of the virus. I've come to that conclusion. We thought March and April were bad, and they certainly were. And in some ways, we're in better shape now. The field hospital's already ready. We already have testing. We're doing 20,000 tests a day. We're seeing outbreaks again in nursing homes, outbreaks in other settings. We're ready. We know how to handle it. But in other ways, this is going to be much, much worse. People are tired. People aren't following the rules. We're all about to go indoors now. Flu season. So try to do whatever you need to do in your life with your family and your friends to ask yourself, what do you need to do to get through these next few months safely? Between now and when we have vaccine, how are you going to change your life to make sure you and your family wear masks, to really make sure you're not going to have informal gatherings, and to take this more seriously so that we get through the next few months with as little pain, suffering, and loss of loved ones as possible. To that end, I want to make a quick note to end on about Thanksgiving. Next week, I'm going to be laying out exactly what the Thanksgiving rules will be, and they're likely to be very strict. And they will be very strict. For now, since people are planning, I'm asking you to stay home, not to travel, and to celebrate Thanksgiving with the people you live with. And that's hard. That goes for me too. We always go, big family, to my sisters, not this year. All of us are staying at home with our kids. So that's what I'm asking you to do. Start now planning for new traditions so that you can stay home and stay local. Because as I just said, we're struggling now due to what happened over Halloween, and I can't let that happen with Thanksgiving, which is a much bigger holiday. Also, if we want to have any hope for a nice, Christmas, Hanukkah, year-end celebrations, we really have to buckle down now. So many of you have been asking me, members of the press, what are the exact rules for Thanksgiving? Next week, I'll issue official rules, but for now, the plan should just be stay home, literally in your house with your family, and keep it low-key this year. So with that, I'm going to hand it over to Dr. Foreman, and then I'll come back to answer your questions.
Thank you, Governor Raimondo, and thank you to Dr. Alexander Scott. I am honored to be here speaking alongside you today, but I am, however, saddened by the reason for my presence. As Dr. Raimondo shared, the numbers of COVID-19 cases in Rhode Island are sharply increasing. I want to take a few minutes to look beyond these statistics and share my actual experiences on the front line of the pandemic and then working here in the emergency departments in our community. I've worked in emergency medicine for over 20 years, and what I've seen here and experienced here in Rhode Island over the last 8 months is unlike anything else I've experienced in my career in this country. It is much closer, in fact, to that which I've experienced working in refugee camps and battlefields across the world. Despite the vast healthcare resources in our state, this pandemic has pressed us to the brink. Our hospitals are rapidly filling up day after day as the numbers in Rhode Island climb even beyond those which we saw in the surge this spring. This is why we need to remain vigilant and do absolutely everything in our power to protect ourselves and others and to halt the spread of the virus. My message for you today is that these are not just statistics and numbers, that this is real. This is affecting our state and our communities and our people. We in your hospitals are seeing the effects of this every day. My team and our teams in the emergency departments around the state, we are seeing the real patients with COVID-19. The ones who are lucky enough to have a mild illness, like the young retail worker and mother who I diagnosed with COVID-19 earlier this week. Her life is still turned upside down despite this being a mild illness, and she is still filled with fear. She immediately began to worry when I gave her the diagnosis about how many of her coworkers, how many of her customers, how many of her family members she may have inadvertently infected, despite her best efforts to keep safe. And she'll be out of work for weeks, struggling with this virus. We are seeing the real patients who come to the hospital struggling to breathe, their lungs filling with fluid, their eyes filled with fear. We know that there is no cure at this point. The best that we can do, we know, is just to support and try to mitigate the effects of this virus. I had this conversation with a fellow healthcare worker last month. He's my age and he'd been healthy, but he, like so many others around the globe, got COVID, and he ended up in the ICU on a ventilator. He did survive, but he is now suffering the long-term effects of post-COVID syndrome. He is debilitated by chronic pain. He struggles to breathe. He has a hard time getting out of bed most days. He's one of the lucky ones, but he may never get back to normal. And he is an example of how vulnerable we all are. Even if we're young and healthy, none among us is actually invincible. And we in the hospitals are seeing the real patients who die. I, along with most of my colleagues, have now been part of so many of these deaths. Because COVID-19 is so dangerous, when infected people are dying in the hospital, they often don't have family members at their side. This protocol is necessary. It has to be for the safety of others, but given the way that we know this virus behaves and is transmitted, but I want everyone to understand that this means that when dying patients are in the hospital, they're usually there alone. And so I and my staff sit by them. We hold their hands, we hold up our phones to their faces so that their families can be there on FaceTime as they die, so they don't have to die alone. These are real patients. These are real people. They are dying in our state. They are dying in our hospitals with a stranger holding their hand through a glove and PPE while their families try to get a last look at their loved one over a cell phone. This is real. It is real because people are affected by this. It is real because there are those who don't get to go home from the hospital. It is real because even those who do get to go home often do not return to a normal life. And it is real because even though some of us are lucky enough to have only a mild illness, the virus still disrupts our lives. It forces quarantine and isolation and leaves fear in its wake. The human cost of this is real, and this pandemic is real. Each of these patients has a real effect on the staff at the hospitals. There are periods in the time when we in the healthcare system are overwhelmed. We try to deny it, we try to hide it, we try to work past it. But at the end of every shift, you can see it in the weariness and fear as we take off our PPE, our faces bruised and scraped by the tight-fitting masks that we've learned to be grateful for. And then we head home to our families, hoping against hope that this isn't the day we bring COVID home to our children, to our spouses, and to our loved ones. Despite all of the precautions we take, we're still afraid to hug our family members. Many of us are still sleeping in basements, on couches and tents, because we would rather do that than risk bringing this deadly virus home to our family members. Unfortunately, given the rate of spread through our communities in Rhode Island and across the country, many hospital staff members have gotten COVID-19 at some point in this pandemic. Some of our staff at each of our hospitals have died from it, both here, across the state, and across the nation. We get overwhelmed, and we feel such sadness for our patients and for their families, and in the helplessness we feel as we see this virus attack the most vulnerable among us, the medically fragile, the economically disadvantaged, and the communities of color at disproportionate rates. These are not just statistics. If I weren't so worried about getting you sick, I would invite every one of you to come spend a day in my emergency department and to live it alongside us. But I can't let you because the risk is too great. And yet it's a risk that we're taking every day because this is what we love and this is what we do. But it's taking a toll on us too. At the beginning of the pandemic, we were concerned about the collective ability of our hospitals to meet the vast medical logistical needs of the pandemic. And so we were asked to set up these alternate care sites, the field hospitals, With a Herculean effort, Care New England and Lifespan, the Department of Health, the Rhode Island National Guard, and an array of public and private groups set up these sites. The Cranston site, with its 350 beds, is ready to mobilize and open the field hospital should we need it. Thus far, we have been lucky enough in this state to be able to take care of all patients at our regular hospitals. The medical community has come together across the state and worked collaboratively across hospitals and system with tremendous support from Governor Raimondo and Dr. Alexander Scott and the Department of Health, who have all been constantly accessible to us and fully responsive to our concerns and our needs, and enabled us to continue providing care at every hospital throughout the pandemic. But if we in Rhode Island continue on our current trajectory, we will outstrip our hospital's capacity, and we will need to open the field hospital within days to weeks. Let me repeat that. If we, the people of Rhode Island, don't quickly change our behavior, we will rapidly overwhelm our hospitals, and we will need to open the field hospital within days to weeks. It will be a tremendous effort to operate this field hospital, but the state is prepared and Care New England is prepared to do this if our state needs us to. Our team, who's been battling this pandemic on the front lines for months, is prepared to do this. But all of us collectively in our state have the power to prevent this. All of us have the ability to stop this virus. It requires short-term sacrifice on our part, to be sure, but we can prevent the suffering and death going forward. And we need to, because this is real. These are real patients, real people, real families, real healthcare workers, real lives. I implore all of you to reevaluate your day-to-day actions and be vigilant in your safety measures in order to help turn the trajectory away from putting our loved ones and ourselves in the field hospital. The Cranston Field Hospital is not the answer. My team works to support and mitigate, but there is no cure at this point. The need here is for prevention. Remarkably enough, the most effective thing we found to contain the spread of this disease and stop the pandemic is in the little things that every single one of us can do every day. The miraculous power of modern medicine has not yet caught up to this virus, but we do know that the seemingly simple things, wearing masks, social distancing, staying quarantined when you're sick, staying home, avoiding social gatherings and crowds, these make all the difference. The steps that Governor Raimondo and state leaders have taken to lower the social gathering limit, to restrict late night activities, to encourage mask wearing and hand washing, these are things that we all need to be doing at this point. Throughout the crisis, they have done an incredible job of looking at the data and making necessary changes to protocols for the sake of community safety, but government can only do so much. These interventions only work if each and every one of us takes them to heart and changes them, changes our practice in day-to-day living. I know that we're all tired of staying in. I know that we're all tired of not being able to hug one another. We're tired of not being able to eat together. We're tired of wearing masks. Pandemic fatigue is real, but so is everything else that I've shared with you today. Whether we give into the fatigue or we stay strong in our commitment to protect ourselves and one another, that is what will determine whether you and your families meet me in the emergency department or whether you meet me when this is all over at our kids' soccer games or the PTA meeting. I hope it's the latter, but it's up to every single one of you. We each have the power and the responsibility to stop this pandemic. Thank you for allowing me to share some of my experiences with you today. Please stay safe.
So you seem pretty exasperated, rightly so.
Yeah.
And I'm wondering if you could bring us through your thought process. People had a lot of buy-in in March, April, and May, and you have done incremental, as you said, trying to do more restrictions. What in your mind convinces you that a lockdown would actually be significant in terms of fighting this, and as opposed to just it's going to decimate business, obviously. But give me the thought process about that if you do go to a lockdown, and that's what everybody's hearing here, oh my goodness, lockdown. How is that where we are now as to where we are in the spring? You need more buy-in, so how do you get that?
Yeah, so a few things. Before I get there, I'm watching to see if any of this takes effect. So we're measuring mobility. Are people actually home after 10 o'clock? We're seeing, are the restaurants empty after 10 o'clock? So if we start to see more of that buy-in, then we can avoid a lockdown. The truth of it is, if there's no reason to go out, the stores will close, restaurants will be forced to shut. That's the thing about this. We are getting good compliance from businesses, schools, retail, and if they're ordered to close, they'll close. And then people will, I think, get a serious message and will stay home. And by the way, you see it in other places. I mean, sadly, lockdowns do still continue to work. The thing that we're struggling to get a handle on is everything I keep talking about, you know, these informal gatherings. But, you know, if church isn't open to go to church, if you can't go to mass, you have to do it virtually and you will stay home on Sunday. So that's my thinking. I'm also thinking about how testing, we have more levers at our disposal right now. So we know, for example, people just aren't quarantining when they're told to quarantine. Hey, you ought to stay home for 14 days, you were close contact. Okay, thanks, bye. They go out, play soccer. So, and we're spending a lot of resources on trying to find those people and get them into quarantine, and I really wish they would continue to quarantine. Maybe there's better technology solutions that we can find to enforce quarantine, ping people constantly. Maybe we need to be focused more on more testing. So what am I trying to say? It's different than April. People are tired. I'm not just going to rely on a lockdown. I'm also looking at new technology, new testing protocols, new rapid testing, and also lockdown. But where we are right now is we're overrun, and we might just need some blunt instrument to settle things down. I may not have a choice. Like, nothing seems to be working right now. So yeah, I mean, I can't see how we would not have a Thanksgiving lockdown. Stay at home order, if you will.
Schools, parents are scared, teachers are scared. We're here saying every day there's new record-breaking numbers. There's a Harvard Global Health Institute, their data and the White House task force data suggests Rhode Island should be at remote learning. Is there going to be a point where you just say we have to flip the switch? You mentioned that, you know, you're coming here one last time, sort of hinting that this is your final straw. So I'd like to hear from you on, do you think that this is going to change? And from one of the doctors, do you guys think it's safe to have kids in school as well?
I may put you on the spot since we were chatting about this, so I'll give you a minute to think. So listen, there is not a shred of evidence anywhere in any country, in any state, that school is a vector of spread. Furthermore, we know that the risk for children of getting severely ill is so much lower. Dr. Ashish Shah, an expert, I met with him the other day, and he said at the beginning, he was nervous about in-person, and now having looked at all the data for the past several months, not just here, but everywhere, he is convinced staying in school for as many kids as long as possible is the right thing to do. As long as we have, you know, testing, cleaning, mask wearing, contact tracing. I'm not saying go to school regular, but we have enormous precautions put in place. The thing about school is the downside to children. When people say to me, shouldn't we just go home? It's really hurting kids. And then finally, we see almost as much virus in the kids learning at home as the ones in school. So it's not like it's a flip the switch, because they're not actually just staying in their room. Yeah. Which of you guys?
So I agree with the governor. When we see patients in the emergency department, we're not seeing tens, dozens, hundreds of little kids from schools coming with COVID-19. We're seeing older teenagers, young adults, and elderly patients. So if the schools were a large cauldron of spread, we would be seeing a percentage of those in the emergency department, and we're not doing that.
You're seeing multiple school districts just in the past couple of days, Charahoe, Coventry, Cumberland, Cranston, West Warwick, moving in some form to distance learning, and in part saying the contact tracing is delayed again. I know we talked about this, but are just the sheer numbers now cracking the system, and is that system overwhelmed, even though the schools may not be a spread? Are there just still too many cases?
Yeah. So I think no, the sheer numbers are not too overwhelming. There are many schools, this is hard for schools, okay? I won't sugarcoat this. There's a lot for schools to do for it to be successful. When someone's positive, they have to send us an Excel spreadsheet with seating charts so we know the close contacts. They have to send us bus seating charts. By the way, I do want to make that clear. That's not just in Rhode Island. That's what's happening all over the country. That's kind of best practices for what schools and school districts have to do. So are some of them getting overwhelmed with that? Yes, absolutely. It's really hard. But by and large, I would say no, they'll be able to keep up. And I also think it's fine if they want to take a few days off. Cranston, for instance, they're taking a few days virtual. Monday was a professional day anyway. They're using a few days to get organized, clean. I think that's appropriate. Take a few days off here or there, get yourself settled, get your systems in place, and then get the kids back in school. As many children in school as long as possible is the name of the game.
Some of those schools are saying to us, though, that they're having trouble kind of hearing back from the health department. There might be these delays with the contact tracing, and so they just kind of have to go ahead and make these decisions. Mm-hmm. Do you feel like that is appropriate, or do you think there needs to be sort of better communication there?
Both. I think that we need to get better, and we are. The volume isn't very intense. We're actually moving to a model where we're going to let the schools have some more ability to move faster, in coordination with the Department of Health. But sometimes they're frustrated, and I don't blame them, that they're waiting on us and when they know what to do. So we are hearing them, and we're going to move to that model where they send us what we need, we go through some process, and then boom, they can communicate with the parents. So I think it's going to get better and better and better.
Governor, you mentioned healthcare workers would have priority for vaccines. Would they be required to take them?
So there's really no way to require this. It's like anything else, and we've gone back and forth around this. And you may want to hear from Dr. Alexander Scott, who's an expert. Some states are doing the require approach. Actually, some states, I think Massachusetts, the governor did an executive order even in the flu vaccine. While I'm not criticizing that, we're not going to take that approach. We feel the better approach to get to high compliance is to make it easy to get versus to force people. That's what we've always done with the flu, and we have found it to work. So rather than force someone, I think the right way to do it is to make it super easy, make it free, and give them all the information they need so it's not scary. So that's Rhode Island's approach, and that's what we're going to do.
Dr. Pullman, if I could ask you a question.
Do you want to answer that?
Oh, I'm sorry.
You want to hear from her?
If you
Yeah, the governor answered that well. We have proven techniques that show that Rhode Island is a leader in immunization. We're going to leverage that infrastructure, that success over time to really roll out the COVID vaccine in a way that is thoughtful and targeted so that we really get at our highest risk communities in the way that works best for them. And what we've seen in Rhode Island is we can do that effectively without necessarily mandating it across the board. So we will be working on that.
First of all, thank you for your very powerful and obviously very personal testimony just a few moments ago. I wonder if you could take this moment to, all the Rhode Islanders who are listening, there is a significant body of Rhode Islanders who believe that a disease with a sub or around 1% fatality rate, that all of this represents an overreaction, that the limitations being placed on business are far worse than the impacts of the disease. I'm sure you hear that in your professional life every day, anecdotally. What do you say to them?
I say, I wish that they could see what we see every day.
I wish that they could spend 10 hours in the emergency department diagnosing people with this disease, trying to save the life of people with disease, trying to treat a disease for which there is no cure, and feel how futile and helpless that is. I wish that they could feel what it's like to tell someone they have COVID-19. I wish that they could feel what it's like to have to call a family member on their own personal cell phone and say, I think your mom only has a couple more minutes left. Do you want to see her before she dies? And hold your cell phone up in the room. I think if you could live this, a 1% fatality rate is far too high. You know, we have done drastic things in this country for far lower fatality rates. I know that this is a big sacrifice for all of us, but it's a short-term sacrifice for massive amounts of good for our population. So I think we have to think about this in terms of not just the personal risk to ourselves, but what risk are we putting everybody else around us at? What risk are we putting our grandparents at? What risk are we putting our neighbors at? What risk are we putting the checker in the supermarket at, or our kid's teacher at? You know, we have to think beyond our own selves and think about all the people this is affecting. I think one of the things that we found in the emergency department is that, you know, many of the patients when they first come in may not have known somebody who has died of COVID-19 yet. All of us do. But once you know, and once you hear these stories, and once it becomes personal, that less than 1% fatality rate becomes far too high. So.
Has enough attention been paid to the non-fatal after effects of the disease, whether it be in the general media or even from state government?
That's a great question, and I would say absolutely not enough yet. What we are seeing is that some people do have mild disease and recover fairly quickly and make a full recovery within weeks to months, but there is a growing body of evidence around this post-viral syndrome, and we don't know enough about it yet. We've all seen a lot of effects from COVID, people having strokes, people having blood clots, people having a lot of after effects of the disease, and this chronic pain and chronic fatigue and chronic trouble breathing that's really debilitating a big segment of our population, people who were previously healthy young people. So I don't think that word is out there enough yet either. I think a lot of people think, oh, it's sort of like having the flu and then you get better. This is not the flu. This is a different thing, and we don't know yet what determines whether you are one of the lucky ones who gets to get totally better within days to weeks to months, or whether you are one of the ones who will get actually sick and chronically sick from this. And we also don't have enough evidence yet, because the pandemic is still so young, about how long this will last. This may be a lifelong syndrome that people are living with that's completely debilitated.
Dr. Foreman.
Alexander Scott, I have two brief questions for you, if that's okay. One is the testing availability. Right now, there was a line outside Dunkin' Donuts Center. Traffic was stopped. It's taking days for people to get appointments. What's the testing availability right now?
It's something that we are working directly on. We recognize the need for increasing access for people who have symptoms. We're opening up an additional site for testing, and we have an added focus on our community's highest hit. We're looking to use, as the governor shared, additional testing technologies, our rapid testing that we've received. We're working with community-based organizations and making sure that there's access available in our high-density communities for doing that. So there's a definite focus on expanding the testing availability as it is.
As for the spike in nursing homes, I know that the governor mentioned trying to divert some patients from the hospital to these nursing care facilities. Can you speak to the nursing home spike there, and do you have any further restrictions on the horizon to try to quiet that down?
What we've seen in nursing homes is mostly a reflection of what we have seen in the community. Cases are rising in the community. Many of the people who work in nursing homes are from the community, and we are starting to see the spillover into the nursing homes associated with that. However, as noted, we have the systems in place and ways to be able to address it that we did not have previously. We are a state that has been doing ongoing surveillance testing of our staff and residents in nursing homes. We're continuing to work on ways to support cohorting patients in nursing homes and making sure that the adequate PPE is needed is available in nursing homes. We recognize it is challenging, and we want to continue the partnership with nursing homes. Appreciate what the leadership has been focused on and what's being done. We want to make sure nursing homes have what they need so that we can continue to ensure people from acute care hospital settings that no longer need to be in those hospital settings can be moved to appropriate settings in the skilled nursing facilities and make it so that we continue to have the capacity that we need in the hospital settings. That's an ongoing partnership. It's something that we're also focusing on with them.
Director, what do you say to people's concerns about hearing that now more people could be moved into nursing facilities, who are hearing that and are concerned despite the fact that I think the governor said they'll be tested twice before they go?
It's the people who are concerned about it, we understand that concern, but we want to make sure they hear about the systems in place in homes. And the biggest key is having people placed in the environments that are most appropriate for them. We want to make sure we don't continue to have people who would do fine in a skilled nursing facility continue to take up beds in a hospital, acute care setting, and make sure that they are appropriately placed safely in the settings where they can be cared for.
On the field hospital, I know the time frame could be days, could be weeks. How do you know when that's going to happen? I've been told that there's no hard hospitalization number. I think the governor said the surge capacity is 600 beds. How do you know when it's time to switch over and the hospitals themselves are overrun?
It is a cumulative approach of a number of factors. You look at acuity of cases, you look at availability of beds that are in place, you look at the trends and what the models are showing, we look at what the partnership with the hospital leadership reveals to us. So that we have in place and will continue to follow closely. We've also worked towards activating the Healthcare Coordination Center so that we can better coordinate across the hospitals that may have more beds available. That will help delay the time to the extent that we can of going into an alternate hospital site, accessing this coordination approach so that we can make sure that all of the beds in the current hospitals are filled as well.
Is there a rough number, 500, 600, when we see that number at 220 patients? Just so people know, I mean, what we're talking about, and I know it seems like kind of a moving target, but is there a rough number?
It is a moving target because it differs across the hospitals. We know in our Providence County, for example, the hospitals are further along. So I'll refrain from giving an exact number. It's similar to what we have been saying with the percent capacity, as well as the other elements that I've shared.
Touch on, if the numbers are going up, I am hearing from a lot of people that are having a tough time getting a test. And if we're increasing, I would think the wait's just gonna be larger. Is that something that needs to be addressed and maybe opening more testing centers?
Absolutely. It was what I answered earlier. Our focus on increasing testing capacity is a priority, particularly for communities where the test percent positivity is higher. That informs us more testing is needed in those communities that are harder hit. What we shared today in terms of the results portal is a key step, and technology really supporting what's needed, because a critical factor is people being able to easily access the results of their test, and for everyone to continue to hear the message about what to do when you have a positive test result. Regardless of the system, we are at a place now in this pandemic where, with shared responsibility, people don't need to wait to be told what to do. If you have a positive test, you need to be at home. What we call isolation is really just staying at home and recovering there. Making sure the people in your household also stay at home. We call that quarantining. They should not be going out to work or to other places because they need to monitor themselves for symptoms. The people in the household need to continue to stay separate from each other to the extent that's possible. You want to continue to make housing opportunities available, hotels or others, for people who are not able to separate in their own homes so that we can minimize spread within hospitals. And people who are positive can know about calling the people who were close contacts with them. If you have individuals that you know you spent 15 minutes or more in close contact, less than 6 feet from them, you can call them when you have that positive test result. They can let and you can let your employer or schools know that you have that positive test result. That's the way everyone can contribute to getting the message out. And overall, we should all be staying home, staying limited to our household, and wearing a mask at all times whenever we're with someone who we don't live with.
Foreman, a question. Dr. Megan Rainey of Brown University, CNN contributor, she posted on Twitter that it was very dramatic the other night, the number of individuals coming to the emergency room, but we're not hearing the ages. Now, you're there in the front lines. How old are these people that are being that they have to stay in the hospital that you're dealing with?
So earlier on in the spring, predominantly we were seeing older people coming into the hospital who were sick enough to be admitted, but now we've been seeing people sort of adolescents and up who are being admitted and who are getting sick. Obviously the older you are and the more comorbidities you have, the more likely it seems that you will become seriously ill with this. But like I mentioned with the healthcare worker, there are people in their 20s, 30s, 40s who are becoming incredibly ill and ending up in the ICU. None of us is invincible. No age and no status of health is protective against this virus.
Do you believe, has the virus changed from the virus you saw back in the spring? Because there seemed to be a period of time, there's no one K through 12 in the hospital, there's no young college student in the hospital. You're saying that's changing and the age getting lower?
We are seeing younger people there, whether that's the virus changing or whether that's just people's activity and behavior changing, and that's leading more people to become sick, we don't know.
Can I just change gears just for a second? The aid program that you've offered for restaurants. I heard from a restaurant owner, he said, the maximum is 10,000. He qualifies for 7,000. This is his email. My business will receive about 7,000. In the fine print at the bottom of the application, it says the state is going to issue a 1099, making the grant taxable. In my case, it's around 1,700 all low back. Why would the state be taxing this when you're trying to give as much as you can to these restaurants?
Yeah. I don't have a good answer for you. I think it's a federal regulation that requires me to do that, but let me get back to you.
Last two, Mike at the top. I have a question for Dr. Foreman. Since you will be the person serving, I understand, as medical director of the Cranston facility, if it has to open, I'm interested in what the next steps are after that. I mean, we would get 350 beds. If we have to open that hospital, we have 600 beds in surge capacity, taking into account surge capacity in the regular hospitals. But what happens after that?
When we fill those
it's certainly possible that cases could extend beyond that demand. And in checking my notes, it seems like an enormous amount of time ago, but I did a story on April 17th in response to Dr. Alexander Scott's announcement that there would be crisis standards of care plans and implementations. And so you would be, I guess, one of the people responsible, if not perhaps the person responsible for primarily making that call. When do you implement crisis standards of care, which in layman's terms is basically rationing services? And how likely do you think that is? I mean, obviously that's calling for a projection based upon behavior and inputs that we can't know, but how realistic is that possibility that we will end up effectively having to ration care?
That's a very hard thing to estimate. Certainly, if we look at other places around the globe, there have been other countries that have had to implement crisis standards of care. If we continue in the current trajectory, I'm very concerned that we would need to. We've already had discussions at all of our hospitals about what this would mean, how we would make decisions about who would get care, who would get services, who would get supplies. It is not a thing we ever want to have to come to. Having done that in other countries and refugee camps around the world, that's not something I ever want to see again. But we also want to be prepared and realistic about the fact that this is a pandemic, which is growing exponentially in our state. So I can't give you an exact answer about whether or not we will have to do that. We are prepared to do that if it comes to it. We are very hopeful that people are going to take this seriously, that people are going to stop taking risks, stop putting themselves and other people at risks, and prevent us from getting there, because we can, as a population, prevent this. We in Rhode Island can avoid getting to a crisis standard of care. We can avoid getting to a place where we have to make decisions about who gets on a ventilator and who doesn't get on a ventilator. We have the power to stop this and change this. So we are very, very hopeful that people will listen to Dr. Raimondo, or to Governor Raimondo and Dr. Alexander Scott, and make the necessary changes so we don't have to go there.
One of the things that motivated my question was that I read this morning that Idaho and Missouri are not at the point of deciding who gets a ventilator, who doesn't, but they're starting to curtail medical services. Are we at that point again, as we were at March and April?
I can't speak to that. I would defer to Governor Raimondo.
What percentage would you say people that are following the regulations? Because, I mean, you're a doctor. You tell people don't drink and drive. People do that. Smoking causes cancer. People smoke. Eat a lot of food, you become obese. People don't exercise. I mean, isn't this part of that? There are just some people, no matter what you say, or Governor, Dr. Raimondo, or whoever, that the people are not going to follow it? Because there are people listening, watching right now saying, I've been following everything that they've been doing, and yet we're hearing these stories. I'm not trying to minimize, but isn't there just some people like don't wear a helmet, don't wear a seatbelt? Like you're trying to regulate human behavior that just...
Yeah, human beings are difficult to regulate at times. I think what's different here is this is less akin to smoking and more akin to drinking and driving. This is putting everybody else around you at risk. You know, whether or not you choose to wear a mask not only impacts you, but it impacts everybody else. It impacts all of us. It impacts everybody who needs to come to the hospital. It impacts everybody you come into contact with. So I think this is, you know, to not follow Governor Raimondo's recommendations now, to not be careful and not protect yourself now is doing something that's actually incredibly dangerous to everybody around you and incredibly dangerous to the state. So, you know, yes, we do not always do what is best for us, but we are really prevailing on people to do what is best for everybody else around you at this point in time. This isn't, I'm not wearing a mask to protect myself. I'm wearing a mask to protect everybody around me. And that's what we want people to do.
I'm going to call her Dr. Raimondo now.
Sorry. Thank you.
But I have a slightly different answer. There's a lot of people who were following the rules who've just relaxed and they need to go back to following the rules. So, and some of us in this room, which is to say, it's human nature. When we were in the thick of it, people were following the rules. I see it every day. The kids, oh, what's the big deal? Pile 6 of them into a car and go get something, no windows open, no masks on. I'm gonna have a little something for my daughter-in-law, a baby shower. We were gonna have 30, we'll just have 6 or 7 girls over. No one wears a mask. You know what I mean? So a lot of people were following the rules. Now we've gotten a little relaxed. We gotta go back to being strict about this. It's maddening to be up here, knowing we're going to open the field hospital, more people will die, we're going to spend however many millions and millions of dollars a month on that field hospital, and it all could be prevented by such simple things. If everybody in Rhode Island went home today and wrote down a list of 6 people that they were going to limit their lives to for the next month, promised to wear their mask wherever they were, cancel social engagements, we'd be fine. We'd be fine. She's nodding. We'd be fine. So simple. But I don't know. I'm struggling to get folks to make that happen.
What's the status of the other 2 field hospitals?
Well, one, there's no status. It's an empty building. We haven't started to deconstruct the convention center. I put a hold on that. So.
With regard to your I'll call it your vaccine review board. It's an intriguing proposition because there's roughly 2 groups of people who are vocal about their concerns about vaccines. You've got folks who question transparency, indemnification, testing, all of that. And then you've got the civil liberties folks who, for example, with the prescription medical database, were concerned about the police involvement in that. Was this decision to do this a reaction to those potential concerns? And are you anticipating holding any type of public review or public sessions to discuss these?
Yeah, excellent questions. So In part, yes, this was a reaction to that. Look, there's a lot of distrust, mistrust. Everything's become political. Mask wearing is somehow political. The vaccine is becoming political. And I am trying to do everything I can to just get people focused on the facts and the science. And I have found that transparency is key to that. So yeah, we're going to put all the data out there. We're going to put the discussions of our group out there because I want people to have some trust. You can't force people to get the vaccine. To your question, we can't force anyone to do it. I want everyone to do it. So this is all about transparency, trust, and process.
Governor, Dr. Michael Osterholm is one of the top coronavirus advisors to President-elect Joe Biden. He said that a nationwide lockdown for 4 to 6 weeks could help control the pandemic and revive the economy. He says that interest rates are so low right now that borrowing isn't a bad idea. And by the time we get out of the lockdown, 4 to 6 weeks after that, the economy should sustain itself. Considering where the state is right now, do you believe that the government should head into a 4 to 6 week lockdown and take out money with the interest rates being where they are? And do you feel comfortable with that approach by President-elect Biden?
Well, this gets back to Hummel's question. You know, nobody wants to go there. And I think you can't do it cavalierly. No, you can't just borrow enough money and hope that that keeps the economy afloat. Having said that, the consequences of not doing a temporary lockdown, I think could be a lot worse. So I don't see the national picture any different than what I'm trying to figure out here in Rhode Island. We ought to try to avoid it. We ought to try to do more testing, yes. We ought to try to get people to comply. I think around the holiday, lockdowns could be well used. If none of that works, we may have no other choice than a temporary lockdown. And if we do that, then the federal government better step up with a serious stimulus because the economy is quite fragile.
Follow-up, are you able to say what next year's projected deficit is? Is it $300 million more? We're hearing it could be double that.
And it's about $300 million each year for 21 and 22. So it's double if you look at the 2 years combined.
December 31st deadline for the money that you have from the federal government. Do you plan on spending that as we get closer to with more of maybe a clearer picture of how things are shaping up before January 20th?
Yeah, I mean, look, I'm up here today. I'm about to start spending millions of dollars a week on a field hospital. We're going to have to do a lot more testing. That's going to be expensive. There are definitely going to be a lot more expenses than I would have hoped. Thanks. By that, you mean me. Goodbye. Say some more prayers. Bye.